So, bringing the meeting to order, could everyone please rise to salute the flag? Allegiance to the flag of the United States of America, to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good evening and welcome to the June meeting of the Revere Board of Health. My name is Dr. Drew Bunker and I'm the chair of the Board of Health. Joining me for tonight's meeting are board member Dr. Craig Costanza. Attendance for tonight's meeting also are City of Revere staff Lauren Buck, who is the Director of Public Health, Michael Wells, who is the Director of Municipal Inspections and Health Agent, and Paula Sepulveda, who is the Board of Health Clerk. Also, we'll have Bonnie Carroll here, who's the Director of the Six City Tobacco Initiative. So today's agenda, first, we're just going to review and approve the minutes from the April meeting, April 27th. So, Dr. Costanza, do you approve the minutes?
Yes, I approve.
Yep, I approve the minutes as well. Great. Next is going to be the Public Health Communicable Monthly Report. Lauren Buck.
Thanks, Dr. Bunker. I'm going to start by going off our communicable, some interesting points to point out on our communicable chart here. So I just want to direct your attention, our influenza cases are significantly down. That's to be expected. We're kind of moving out of influenza season, 13 cases for the last 2 months since we didn't have a meeting last month. I also want to direct your attention to the Lyme disease statistics. Over the last 2 months, we've had 2 probable and 6 suspect Lyme disease reports in the city. Later on, I'm going to talk a little bit more for the audience about things we can do during the spring and summer months, which we are now in, to help prevent from tick-borne diseases. I also want to direct your attention to our salmonella cases. We had 8 confirmed over the last 2 months. Mike and I have been working together to make sure that we are on top of the cases that are related to any restaurants in the city. Our COVID monthly report, which will continue for this month, but we will potentially not be reporting on COVID monthly anymore after this month, as the state has changed some of its reporting, and really we're at a point where we probably do not need to report on it monthly. But for now, our total confirmed and probable cases are 26,773. Our daily average number of cases is 2. Our 14-day positivity rate is 3.85, and our total deceased to date is 205. So if I can just take some time for anyone listening on Revere TV, I just wanted to talk a little bit about tick-borne disease prevention. Massachusetts, this is super important as we are an area that has a significant tick population. So in Massachusetts, certain kinds of ticks can bite you and spread diseases like Lyme, babiosis, anaplasmosis, tularemia, Rocky Mountain spotted fever, Borrelia, and Powassan virus. Ticks do not fly or jump. They attach to animals or people that come in direct contact with them. Deer ticks and dog ticks are found throughout Massachusetts. Deer ticks are responsible for spreading Lyme disease, babiosis, anaplasmosis, Borrelia, and Powassan, and dog ticks are responsible for spreading Rocky Mountain spotted fever and certain types of tularemia. The highest risk of being bitten by these kinds of ticks occur right now during the spring and summer. One of the most important things you can do to prevent tick-borne illness is to check yourself for ticks once a day. Remember to check kids and pets too. Remove any attached ticks as soon as possible. Use a pair of fine point tweezers to grip the tick as close to the skin as possible and pull straight out. You should not apply kerosene, jelly, nail polish, or hot match, some of those things that we've all heard about or seen on YouTube. These measures are not effective and may result in injury. Make sure to note the date and where on the body the tick was removed, and make sure you call your healthcare provider to discuss possible treatment options. And to help prevent any tick bite, you make sure you stay to main pathways when you're hiking or walking outside. Wear light-colored long-sleeve shirts with long pants and tuck them into your socks if possible. I know that's not super fashionable. And make sure you use bug repellent and use it as listed on the label. So just a good little reminder as we go into the as we go into the summer months, Massachusetts is really a hotbed for ticks. So we need to make sure everyone's aware of that. And that's it.
Great, thank you so much. Next is the Inspectional Services Monthly Report with Michael Wells.
Thanks, Dr. Bunker. Board of Health inspection stats for the month of June. For the Interior Housing Division, we performed 108 certificates of fitness. That is a little bit higher this month as one of the new apartment buildings did receive occupancy. We had 4 re-inspections on certificate of fitness. We had 7 interior complaints, 5 interior complaint re-inspections, 2 pool inspections, 7 re-inspections on pools, and 12 inspections on, I'm sorry, no re-inspections on that. On the food inspection division, we had 31 routine inspections, we had 14 re-inspections, and we had 5 complaint inspections on the food inspection division. On the exterior sanitation division, we issued 49 violations for accumulation of litter, trash, and garbage and debris, 37 violations for improper bulky items, 171 violations for garbage and trash overflow, and we also issued 100 violations for unclean, unsanitary land, which includes overgrowth and vegetation. As we enter the spring and summer months, those violations tend to get picked up. So a reminder to our residents to ensure that your property is maintained, free of overgrowth, so there's no rodent harborage going on. And we also issued 2 violations for working without permits.
Great, thank you. Next is going to be the violations of the tobacco product sales. Today, we just have one business who had a compliance check on May 14th at 5:14 p.m. That was State Road Liquors, 116 State Road. And this is their second violation of the tobacco laws. And again, just to reiterate, these laws were brought forth by the state. We enacted them through the city of Revere, and we're following basically the guidelines that were given to us by the state in ensuring that we're not selling tobacco to underage minors. I think State Road Liquors is here today, so if someone from there wants to come up and speak.
Hi, how are you doing, Dr. Bunker? My name is Kevin Langs. I'm a resident of Revere since 1987, doing business in Revere, different places, raising kids, families, whole generations here. My dad's here, me is the 3rd generation right now. And all my young kid is in the teen also. My intention is not to serve kid under 8 for cigarette, but accidentally have been made because one of my employee is a new employee, been training at the time, and he used the way of they doing thing in a different country. He look at the person and say, okay, he look old. He look older than me. I'm 57, so he must be at least 40. So we don't check the ID. So he slipped through that part, and that's the mistake. And I guarantee it's not going to happen again. The next people walk by without ID, we will not serve no more. And that's we ask for forgiveness for this time. If the board can allow us to serve the cigarette without suspension, we'll be happy. If the board not allow, we're still happy, and we'll try to maintain the way we operate the business then.
Well, thank you for coming up and speaking. Yeah, it's a challenging. I know that a new employee not knowing the whatever goes on in their country, but there's a reason we have the laws. There's a reason why we have these regulations, and we really do have to abide by them. And I understand the frustration because this is your second offense, and you've lived in Revere a long time, and you've done things by the book and follow the laws, but we just have to be as careful as possible. And I hope this is an opportunity for training within your business to try to make sure that all IDs are checked. I know it may seem silly when you look at people of different ages and say, why is an ID getting checked? But it's for the protection of the kids at the end of the day. So think unfortunately we have to follow the state guidelines, which doesn't feel good for any of us, but at the same time, we just want to make sure we're doing things correctly. But again, I apologize, and I know that this will never happen again. We won't see you ever again. Yeah.
Guarantee, sir.
Okay. Thank you.
Thank you very much.
So yeah, Craig will just to get your vote to continue with the suspension for the second violation.
Yes, I approve.
And that suspension will be a fine of $2,000 as well as a 7 consecutive business day suspension of tobacco sales. I know it is harsh, but it's the guidelines we're trying to follow at this time. Thank you.
So I'll just say, we will send a letter, a certified letter that that we tell you when the suspension will be served, and also if you can, the fine needs to be paid to the city clerk's office as soon as possible. Okay.
Great. I think that's it for the agenda today. So this will conclude this month's meeting. Thank you.